Hello. I wish I could be there at Harvard Medical School tonight for this special symposium on inequality and health, but I'm afraid we're just going to have to do this one by video. I'd especially like to be there with my good friends and my sometime co-authors, Steffie Woolhandler and David Himmelstein. It will give me a chance to thank them in person for their long-time dedication to healthcare as a basic human right. You know, this one is personal for me. When I was 12, my daddy had a heart attack, and I saw what that was like firsthand. The medical bills piled up. It turned our lives upside down. And that's a familiar story for too many families here in Massachusetts and across the country. When I was a law professor, David and Steffi and I launched the first study of medical bankruptcy. And we found that medical bills were a factor in about half of all bankruptcies. Addressing economic inequality is deeply entangled with fixing our healthcare system. It's one of the many reasons that I was deeply troubled by the recent Republican effort to repeal the Affordable Care Act. Their replacement bill would have gutted Medicaid and struck a devastating blow to millions of Americans. I'll say it, I'm glad that bill failed, but our work isn't done. I remind myself every day that the Republican bill failed in part because for some Republicans it wasn't brutal enough. But this is all the more reason to keep fighting so that every American can access the affordable, quality health care they deserve. It is time to take steps to end health disparities across incomes, genders, and racial backgrounds. I'm trying to work on that in Washington, and I'm glad you're discussing these kinds of issues tonight. Your work is an important part of how we will improve our healthcare system. So I'll say it again. Thank you for the chance to join you by video, and most of all, thank you for being a part of this fight. We're in it together.